I'm Dr. Ben. You're probably watching this video because you or someone you know thinks they might have a gallbladder problem. Well, let me give you some tips here because this could be a very quick acting problem and you need to know how to respond to it. I had my gallbladder attack exactly 4 weeks ago, September 2013. I thought I'd done all the tests the previous week to determine that my serum profiles were perfectly normal. The physician had done the palpation tests in the abdominal quadrant that would normally provoke a gallbladder response if there was a problem. None of that happened. My lab results were perfect, no gallbladder palpation problems, and yet 3 days later after I had those tests, I had an acute gallbladder attack. Of course, it always happens at night when you don't have but limited facilities and people to call. So hopefully this video will give you some quick tips. First thing I want you to know is that the gallbladder can cause many different symptoms. The differential diagnosis might include things like trying to evaluate whether you're having a minor heart attack, whether you're having possibly an aortic aneurysm, maybe intestinal blockage, maybe blood clot, thrombosis. There's several other things. Bottom line is, you don't really know. However, it's just natural for us to try to figure out, well, maybe I pulled a muscle, maybe it's not anything too serious, but this is precisely when you need to be doing some very important things. In other words, plan B, planning. Plan A is to just pretend that, nothing's going on, you've just done something to your muscles, whatever. Plan B is going to get you some help. But first, let's talk about the most common symptoms. The most common symptoms for me, and I also looked at a website where a fellow named Tom had similar symptoms. The most common symptoms were back pain, sort of in the upper part of my back. A very acute back pain. I had chest pain under the sternum, and this chest pain radiated to the back. Normally, I would dismiss this as being some sort of pulled muscle, something like that. So I started taking some Lortabs and so forth. Didn't help. Even took a nitroglycerin tablet trying to dilate vessels. Didn't help at all. So then I tried to figure out some other things. Now, during this time, I'm feeling my pain levels start to slowly go up, but I'm still trying to brush it off as nothing. However, I'm also thinking this could be something that I really don't want to mess with, so I've sort of got one shoe in the door, so to speak, while I'm still toying with trying to diagnose, because look, my lab tests were normal. The doctor said I was fine. That was 3 days ago. So how could something so suddenly come upon me? Well, it can happen very quick. Now, I want to mention a couple other things. When you have an attack, you're not going to get warning. You have maybe as little as a 30-minute time window, so you have to react quickly. Now, that means you need to do a couple things. In the next 30 minutes, you need to be thinking about where you're going to go, which hospital, so that if it's not just a pulled muscle like you're thinking right now, you'll have some destination in mind. You need to figure out how are you going to get there. You're going to drive yourself, have someone else, a designated driver, drive you, which would be best. But you need to be thinking about this as you're getting the other foot out the door slowly. And lastly, you need to think about who's going to do the surgery. And we'll talk more about that later because that caught me totally off guard. When I had my attack, nothing immediately seemed to be working. I knew I was in unfamiliar territory, to say the least. I headed out the door, drove myself nearby to the hospital, which was only 1 block away. They admitted me, and then they started asking the usual questions. They asked me if I was nauseous. I said yes. They didn't seem to believe that until I threw up in the garbage can and so forth. Then they started doing the CAT scans and other tests. Very quickly they came back and said, you have gallbladder inflammation, it needs to be removed. Which brings up the big question, who's going to do it? Now, they have a surgeon on call. Now remember, we can't ask everything. Surgeons are highly skilled, very competent, but you never know when you're going to run into a case where it doesn't follow the textbook examples. That's when you need a specialist. So I'm going to tell you in just a minute how to find one. So you need to be thinking as you're going to the hospital, who will I call? Maybe you already know someone, or maybe you can call your family doctor for a quick referral. At the same time, you want to find out if they're part of your insurance plan and so forth. There are a lot of things that you're going to have to figure out. So when you get into the operating room and your ER doc says you need to have your gallbladder out, then if you don't have a surgeon in mind and he says, well, we've got a good one here at the hospital, ask him, is there another surgeon, or who is the best surgeon that has the least number of patient callbacks? Because I don't think they're really allowed to tell you who their opinion of the best surgeon is, but they can give you a factual base as to which surgeon has the fewer number of patient callbacks. That's what you want to know. And when they tell you that, then you ask your ER doc, would you please call him and say that we have requested for him to do this surgery. Now, the importance of that, I find, is that the people I've talked to that use the general surgeon, they always seem to encounter some sort of inflamed gallbladder, and then they say, well, sorry, but we had to just split you up, you know, from the waist up to the neck or something like that, and take out everything and put it back in. That's a pretty big operation. Now, if you get a specialist, there are techniques that can avoid that. In my operation, when they went in laparoscopically, they did find an inflamed gallbladder. It was distended. It did have infection, had all of these scary things that normally a surgeon would probably say, well, we just got to rip you up. But my specialist went in with a special tool and they just sucked out everything in the gallbladder, reduced it in size, and then pulled it out through one of the openings. By the way, they use about 4 incisions to do the work. They actually pull the gallbladder, at least here, out the belly button, and they use tubes for locating the other parts. So if you can avoid the major surgery, that's what you want to do. Allow them to do it laparoscopically because you're using a specialist that's done this. He knows just what to do. That'll save you a lot of heartbreaks and a lot of perhaps callbacks and pain and so forth. Other than that, expect to do the usual procedure where you've got to be sent home in a few days. And they usually tell you, you'll be here overnight. Prepare for several of those commercials. Well, one more night for sure. But when you go home, you're going to be draining fluid out of a line. What they do is they put this tube inside of you, and you'll notice the white part here is full of little holes, perforations. And this is where the blood filters into the tubing. It will actually thrombose in these holes, so it'll keep out clots. And then your serum, your clear serum, will come out this tube into a little collection chamber that you'll wear on your belt or something for the next several days. Now, you're going to have a lot of this serum that's going to seep out around the tubing. You'll see some little stitches here, and this is what you see on the outside of you. You don't see the rest of this. I thought it was only about a ½ inch long, but it's a little over 1 foot long. So this is tucked inside you. You just see this part, and you get to clean that out and measure it each day. Now that means you got to go home and you got to take care of yourself. The hospital will send you home with some sort of little trainer bandages that are way too small. Here's what I use. Because I'm a naturopath, I look at alternative ways of doing things. I'll take a roll of paper towels and I'll pull off about 6 of these and just kind of fold them up like this, and whatever is convenient. double them over. I do a little neater when I'm doing it on myself. At your health store, you can buy this plastic back material that has a soft cotton side. This is waterproof. It'll stop fluids. So you cut a piece of this off, put it over here, and then you tape this on your side. You want to have a huge bandage because you're going to be draining serum fluid all the time. There's no way to stop it. Now, how do you tape it on? To tape it on, I use a roll of regular masking tape. It works fine. But let me caution you, just use the minimum amount. Cut little tabs. You're going to have this serum that's going to go down on your underwear and everything, and your t-shirt. Just keep wearing some old clothes, and, you know, in 4 days or so it'll quit. Your doctor will take out the tube. They usually take this tube out somewhere around 3rd, 4th, 5th day. So you're going to have plenty of drainage problems and leakage problems. That's okay. It's not a big deal. It's just clear stuff, and it's kind of messy. But this is a good tip. Now, the reason this does not cause infection, because some people think, well, how can that be sanitary? Because it's a paper towel. Always an interesting comment like that. The reason that paper towels, white, will stay sanitary is because they contain lignin, which is bactericidal, or certainly bacteriostatic. In other words, it will kill bacteria. So I've never had a problem with that. I use it for all my wounds. So that's a good way to handle the massive amount of leakage. They'll give you a little jar to take home, and they'll tell you twice a day, dump all the serum in here. It'll look bloody and straw colored, and measure it. And as it goes down, you report that back to them. And that's pretty much it. But the big thing that I want to let you know about is the most common mistake everybody makes, including me, and I'm a naturopath, is don't try to second guess whether or not you've got a real serious situation. As you're experiencing discomfort, be thinking in your mind, well, at the same time, I better be getting my coat and shoes and hat on because it could be getting worse. And if it's something serious, it will be getting worse quick. Let pain be your guide, because within a few minutes, the pain will elevate to a point where you know it's time to go. And it's time to quit trying to second guess what's going on, because there are too many things. Could be a heart attack or intestinal blockage, yada, yada. But you're going to be a step ahead. You're on your way to the hospital, and you're going to get there. And as soon as you get a diagnosis, you're going to ask for a specialist in the field, and that's very important. And then you're going to request that specialist. And of course, you may need to make sure that they're all part of your provider insurance network. Otherwise, you'll be in Siberia breaking rocks for a long time. Probably shouldn't have said that. They have some very interesting rocks there. That's all I want to share with you. I am pretty much healed now in 4 weeks. My incisions have all closed up. Nothing more to tell, but I'm glad that, looking back, that I requested a specialist. Because what my doctor told me, that I had a lot of infection and a distended gallbladder, a normal surgeon would have done the long road, would have unzipped me, and I would be going down a long, slow recovery. So I hope that's helped you. I don't know how many more of these videos I can make. I guess I'll just wait till something else drops off, and then we'll talk about that. But for now, stay healthy, and I'm staying healthy. I'm out walking a couple miles every other day, trying to do a little rollerblading and a little swing dancing when I can. So I'm good to go for now. Thanks, and take care of yourself.